Welcome to this introduction to the Library Toolkit for Addressing Health Misinformation. Health misinformation is false, inaccurate, or misleading information according to the best available evidence at the time. Misinformation is harmful. It can lead to confusion and misunderstandings with negative consequences, such as taking unproven and dangerous treatments. Addressing health misinformation is a public health priority. The Surgeon General describes it as a serious threat to public health and calls for everyone to help stop its spread. Health misinformation was also declared a public health crisis in the county of San Diego in California. In this video, we'll cover the following: starting an online public education campaign at your library to address health misinformation in local communities. We introduce our toolkit of educational content to share on your library's communication channels, particularly on social media. This content is customizable. We share design templates for you to tailor the materials to your community. We'll then share some tips for launching a campaign. Finally, we ask your help spreading the word about this toolkit. Libraries can launch an online public education campaign to help stop the spread of health misinformation. We can teach community members the skills connected to health misinformation resilience. These skills include spotting and protecting yourself from health misinformation, checking if health-related content is credible, finding reliable sources, and helping stop the spread of misinformation. Promoting health information literacy is a simple and impactful way to keep our communities safe and healthy. Our toolkit helps you launch the campaign. It's designed for library workers who serve communities in public, academic, and school library settings. Organizations in health literacy and health communications may also find this toolkit helpful. Our toolkit supplies educational content for a campaign. You can share this content on your library's social media, blogs, websites, digital displays, newsletters, and other communication channels. You could also make print copies to display in public areas or distribute at library events. There are 3 types of content. We advise using them together. First is fact sheets. There are 4 available. Each fact sheet addresses a different skill for health misinformation resilience. They're available in 10 languages, and we strive to write them for an 8th grade reading level or lower. Each fact sheet is 2 to 3 pages long, so we made a 1-page summary version that you can easily print and hand out. There are many ways to share the fact sheets. We encourage you to be creative. Here are just a few ideas. Upload a copy to your library's website, share a link to the Avoid Health Misinformation Guide, which has all the fact sheets, display a copy on a bulletin board or digital screen, and give out printed copies at public events. Sample messaging is the second type of educational content. These short promotional messages give bite-sized training on health information literacy skills. They also encourage people to read the fact sheets. We provide sample messaging that you can copy and post on Twitter, Facebook, Instagram, and blogs. The messages are available in English and Spanish. The third type of educational content is video. The videos summarize the fact sheets in under 3 minutes. Embed them on your library's website or share them through social media. We encourage you to creatively share, revise, and build upon the content in this toolkit. Please follow our Creative Commons license. We ask that you do not use these materials for commercial purposes. We encourage you to customize the fact sheets and graphics in the toolkit. Make versions that fit your community. Use our design templates and change any text or images. The templates are for use in Canva, a free-to-use online graphic design tool. If your library serves a community outside of San Diego County, California, you need to make some important adjustments. Add descriptions of the regional library and health services available to your community, and remove references to San Diego County services. Let's explore tips for launching an online campaign in your community. There are 2 key activities for an online campaign using this toolkit. First, share the fact sheets with community members, and then encourage people to read them. There are different ways to share the fact sheets. We encourage you to share them broadly and try new and creative ways of connecting with your community. To encourage community members to read the fact sheets, share promotional messages. Post the sample messaging and videos on your library's website, newsletter, blog, social media, and other communication channels. Use a campaign hashtag to increase visibility and track the online engagement with the content. If your library serves a community in San Diego County, California, we encourage you to use the hashtag StopMisinformationSD. If your library serves a different region, try a hashtag like Stop Misinformation followed by your community's abbreviation. To track online engagement and trends around your campaign hashtag, check out the CDC's Social Listening and Monitoring Tools Guide and learn more. Coordinate your campaign. Post the campaign messaging on a schedule, such as weekly posts over a month, or share them during special periods like Health Literacy Month or National Medical Librarians Month. Also, try coordinating with partner organizations to reach more communities in your campaign. Community members may have questions about health misinformation and contact your library for help. Point them to credible sources. Share links to educational content from the Surgeon General, Medline Plus, and the National Library of Medicine. Refer people to healthcare providers and services if they seek medical advice at the library. Watch this video to learn best practices for handling health reference questions. It's a training workshop by the Network of the National Library of Medicine. Learn more about launching health communication campaigns. We use the following CDC guidelines and resources to develop this toolkit. They can help you learn the foundations of online health communication. We hope this toolkit gives libraries a low investment and high impact way to address health misinformation in communities. Please help us spread the word. Consider sharing this toolkit with your colleagues and partner organizations. We'd appreciate you filling out this form to let us know that you plan to use this toolkit to launch an online campaign at your library. Filling out this form is optional. We request your contact information so we can share any updates on the toolkit and ask for your feedback later. In summary, your library can start an online public education campaign to address health misinformation. Teach community members the skills for misinformation resilience. Use our toolkit of educational content. There are fact sheets, sample messaging, and videos to share through your library's communication channels. We encourage you to customize the content. Edit our design templates so the content matches your community. Some tips for launching your library's campaign. Keep it simple with 2 key activities. Share the fact sheets and encourage community members to read them with promotional messages. Use a campaign hashtag to increase visibility and track your content. Coordinate your campaign on a schedule to give it structure and focus. Start a campaign with partner organizations to reach more communities in your region. Point to credible sources about health misinformation and learn more about health communication campaigns from the Office of the Surgeon General, the National Library of Medicine, and the CDC. And help us spread the word about this toolkit. Encourage other libraries to start a campaign about health misinformation. Thank you for watching this video. We wish you great success in addressing health misinformation in your community.